Greetings and welcome to another episode of Going All In, Get the Edge You Need to Succeed. I'm Dr. Erin McKinley, and today we have an update from Dr. Sherry Foret and Ashley Gary from the Nicholls State University Dietetic Internship Program based in Thibodaux, Louisiana. Check it out. All right, welcome back to the podcast. To get us started for this episode, I would love for the new viewers' benefit if you would give us a great introduction to you, your journey to RD, and how you landed with Nicholls.
I'm Sherry Foret, and I'm the internship coordinator here at Nicholls and an assistant professor in the dietetics program. My journey started at Nicholls, 30 years ago when I came here for my bachelor's degree. I love Nicholls. I love the campus. It's a family-oriented university. It's small, so we really get to know our students. So when I finished my dietetics education, I worked at Chabert Medical Center for 16 years. I did outpatient, clinical, food service management. I did it all there. And then I've been here at Nicholls as I started out as an instructor in 2013. So I've been here for, I think, 8 years now. Looking forward to retirement.
I'm Ashley Gary, and I'm the clinical instructor for the internship program. I have been a clinical dietitian for the most part for going on 11 years now. I got my undergrad at LSU, and I did my internship and master's degree program at McKinley State University. And I have been working for Nicholls for going on 5 years now since we restarted the program in 2017.
All right, well, I'm going to let you jump right into your slides to give us an update on your program.
All right, so I'm going to talk to you guys about the program mission and goals. Our mission of our dietetics in our program as a certificate program is to prepare interns for to be self-directed, accountable, entry-level registered dietitians, and to develop graduates who are committed to professional involvement, leadership, and service. And our goals reflect our mission, since goal 1 is to prepare graduates to be competent entry-level dietitians, and goal 2 to prepare graduates who are committed to professional involvement, leadership, and service. So the requirements to be accepted into the program are a DPD verification statement, which you will get upon graduation. Prior to graduation, you will get a declaration of intent or letter of intent to be able to apply for programs. The minimum GPA requirement is a 3.0 overall, and we do a calculation for the GRE. The composite score, our preferred composite score, is 340, but that's your DPG GPA times 20 plus your verbal plus your quantitative on the GRE. You have to apply through the DICAS program and use the D&D digital matching system to apply to our program. We do have a pre-select, but the pre-select's only open to Nicholls graduates. So once accepted to our program, you would be required to have all of the vaccinations, including the COVID-19, and vaccinations usually include MMR, usually the ones you have to get for college anyway, but there are some that are extra. You have to get the TB test and things like that too. You are required to have health insurance and professional liability insurance to be able to work in the hospital. So the graduate program offers 15 credits toward a master's degree. We don't currently have a master's degree at Nicholls, but we're hoping it's going to be approved on December 15th at the Board of Regents meeting. And so hopefully we will begin the master's in the fall, hopefully. So we may have a master's degree. Most master's programs allow you to transfer 9 hours of credit toward their degree. So, and as you know, you guys are going to have the master's degree to be able to sit for the RD exam. So our program usually runs late June to early May, so it's a 1-year program, and we usually follow the academic calendar for the most part. Our focus is on medical nutrition therapy with a concentration on the nutrition-focused physical exam, which, by the way, was not required when we came up with that concentration. Now it's part of the competencies, but back in before 2017, when we started, it wasn't part of the original standards because we were using the 2012 standards. So we provide approximately 1,000 hours, 500 clinical, 300 food service, 200 community, and we match 12 interns per year. The tuition is $10,000. We try to keep it low. I'm trying to decrease that, but it's not working. But so tuition is $10,000 and it's paid in 3 installments of $3,333. And you might have caught that one will be $3,334 to come up to make the 10,000 even. So these are just some of the costs of the internship, in addition to like immunizations, background check, drug screens, the tuition we mentioned before, the application to graduate schools required to start graduate school here, that's $20. So even if we don't have a master's, when you apply, you still have to apply to graduate school because we provide graduate credit. So in order to get that credit, you have to be a graduate student here. So we do require academy membership. The malpractice insurance will run you $50 to $80. Background check and drug screen. We use a system called Castle Branch, and they do that plus the immunization verification. So that'll be all one lump sum payment there. Housing, it says highly variable because you can live on campus if you'd like to. A lot of students choose to get together and rent their own place. But campus housing is available for our interns even in the summer. So we just need to know ahead of time so we can set that up. Parking on campus is $50 a year, which is, I think, pretty cheap for parking. You don't want to not get a parking pass, and you don't want to park in the wrong place because it might cost you $200 to get your car out of Hawk. So get the parking pass. Other systems we require, we have a few books. The student tracking system we use is Typhon. This is where all the evaluations and time logs are kept, case studies. You load to that system. Preceptors do the evaluations and approve the time. Our visual veggies is our study aid for the RD exam, and we do require subscriptions to the visual veggies. You will have to take quizzes throughout the semester from using visual veggies, and of course the nutrition terminology subscription. The program for the ENCPT is a required subscription as well. You need that for your clinical rotations. Uniforms, we wear scrubs, a black pants and a red top. So we usually tell you which ones to get, or give you options of which ones to get. So depending on how many you get, that could run you about $100. You are required to attend a conference. It could be FNCE or LAND, and hopefully FNCE will be in person next year, but it's been virtual, which kind of made it easier to attend, I guess, but less expensive for sure. But we do offer you to attend either one, but attending a professional course does count toward competency, so we do require one. And then you are required to attend an RD exam review course. So, and we are giving the interns this year an option to choose one of their preference, but one is required.
All right, so as Sherry had mentioned, our program does have an MNT focus with an NFPE concentration. Our program is a little bit unique in that my role is to take you into the hospital, act as the RD there, and teach you at the same time. I do try to show you different ways of doing things and different ways of thinking about things so that you're better equipped to make those professional and clinical decisions once you are in your career. Your rotations with me last approximately 7 weeks. You have 1 week of an orientation or NFPE seminar week. I also refer to this week as the MNT boot camp week because we do somewhat of an intensive training in MNT basics. Then we go to the hospital and we are there for approximately 6 weeks. And from there, you have 4 weeks of moderate supervision and staff relief rotations, 2 weeks of moderate supervision and 2 weeks of staff relief. The 2 weeks of staff relief have been built in so that you have enough time to become acclimated with the new facility and become comfortable with how they do things there so that you can put to good use all the things that you've learned from your clinical rotations in your staff relief, your 2 weeks of staff relief. Those rotations with me are in a group setting. So you do benefit from working with your peers and learning from the experiences that they're having, their patient experiences and interactions, as well as any questions that they might ask. You get to learn from each other and bounce ideas off of each other and really kind of discuss things. In addition to those, we do have also 2 weeks of renal rotations and a 1 week oncology rotation. All of our rotations are generally 36 to 40 hours per week. With the clinical rotations, potential experiences do include swallow studies, PEG placements, and endoscopies with the hospital schedule permitting. And some of the assignments that we complete include case studies and in-service presentation, and also presentations, one of which is a mini NFPE seminar in which you as the intern create your own little NFPE class in order to teach your preceptor how to perform the NFPE. Food service management is another good portion of our program. It takes place at multiple site rotations, including large and small scale hospital operations, as well as nursing home, retail, or commercial food service establishments, as well as school food service. And experiences include a theme meal project in which you plan, procure, and carry out an entire theme meal at one of the hospitals. You are the manager that day, so it's a pretty intensive food service management experience that you get to undergo. There's also the quality improvement project in which you observe and research an obstacle that exists at your facility and compose a proposal in order to fix it. Our community rotations include sites such as WIC, Outpatient, LSU Co-op Extension, Summer Camp, and Grocery Store. The experiences that you might get include farmers markets, wellness presentations and classes, grocery store tours, as well as cooking demonstrations. We do also have a couple of info sessions or observation days, one with the RD for the New Orleans Saints and another with an RD at a correctional facility. And we are looking into a wellness and fitness nutrition rotation, as well as a bariatric rotation, hopefully, which we'll be able to get in the works for next year. As Jerry said, our schedule does follow the Nicholls State University calendar. And however, our weeks are 36 to 40 hours per week. You still get the normal holidays off, 4th of July, Thanksgiving, Christmas, Mardi Gras, and spring break. And in terms of completion requirements, we utilize digital evaluations through our electronic tracking system, Typhon. These evaluations do have the student learning outcomes or student learning objectives or competencies based on the ASEN core competencies, where the intern must earn a score of 2 or higher on a 3-point scale for all learning objectives tied to a core competency. The interns also must receive a grade of B or higher each semester in order to receive the graduate credit for their course. And per ASEN requirements, complete a minimum of 1,000 supervised practice hours. So that is the gist of the overview of our program.
All right, well, I will jump right into the new 5 questions that I ask all of the programs that come back to the podcast to give us an update. And so the first is, what is one major improvement to the program that was born out of the COVID-19 pandemic?
So COVID did allow us to compile a fairly extensive collection of real world case studies and assignments that can all be done virtually in order for interns to still receive applicable experiences as well as hours if they're unable to be present at rotations. and as well as the ability to Zoom or attend some rotations virtually if needed under approved circumstances. And that does include the ability to remote in at the hospital under certain approved circumstances in which that might be necessary.
All right, my second question, looking ahead, what does your ideal class of interns look like? And that could be characteristics, qualities, personalities, different experiences they bring to the table. What are you looking forward to in a future intern class?
For me, interns would be first academically prepared, particularly in MNT. I've noticed that a lot of my students who aren't as prepared in the MNT arena, or they haven't had any kind of hospital experience, it takes them a little bit more to catch on. So the ones that have had that hospital experience are those that are really fully prepared in the MNT arena. They do tend to catch on a lot more quickly, and they end up ultimately performing better in their clinical rotations. So academic preparation, they'd be independent and motivated, and they'd have a positive attitude and mindset. They'd be ready to work hard, and they'd be able to apply themselves while requiring little direction. So that would be my ideal class of interns.
Sherry, do you want to include anything else?
No, that's her ideal. I think that's everybody's ideal class of interns is what I was thinking.
All right, perfect. So what are you currently doing to try to improve the diversity of your intern classes?
Well, as far as diversity and inclusion, I think the university is making great strides towards improving our understanding of diversity and inclusion. And Nicholls, it has a big population of first generation college students who may not have the background, the financial resources, or the support that, other students who are not first generation have. So I think that, and they are implementing continuing education for faculty concerning diversity and inclusion. And ASCEND is offering webinars on that too. So we're taking advantage of that kind of those programs.
So continuing on with diversity, equity, inclusion, how are you planning to integrate that type of information into the curriculum for the internship to improve the experiences for the interns?
For sure, especially, in the clinical setting, we do work at a hospital that sees a lot of low income population and Medicare and Medicaid population, as well as uninsured population. So they do get that type of experience with that population of people, as well as in the community setting. They also, go to other facilities where the population is a little bit different than that in terms of income and education level. So they get to see a wide range of people in those arenas in terms of income level and education. And Nicholls being in Thibodaux is somewhat of a cultural immersion in and of itself, especially for people who aren't from here. You see quite a few true Cajun down the bayou people, and it's a very different way of life, and it's a very interesting way of life. And our students do get some good experiences in learning cultural awareness and a cultural appreciation in working with those types of people in terms of nutrition and dietetics.
Yeah, as Ashley said, that Nicholls is in a unique position to really for interns to really experience the Bayou life.
You have to see it to believe it.
Yeah, it's great though. We love it.
It's an understatement.
All right, my last question of the new 5, other than the skills that the interns acquire and practice throughout the CRDNs that you're required to have in the program, what other skills-based training are you including or planning to include into the program?
So in the clinical rotations, while the NFPE is part of the the competencies from ASEN, we do a pretty intensive immersion into it. We do our seminar in the beginning, and we do a lot of simulation for the nutrition focused physical exam, quite a few hours of it, so that our students can become comfortable with the process of it, as well as how to diagnose malnutrition, so that when we do go into the hospital and use those skills, they're comfortable with it. And once they do start actually touching people, you know, they know what they're doing. And when we're in the hospital, we do get to touch a lot of people. I try to look for those particular patients and give them those experiences, so that they have quite a bit of experience in real time, real world settings of actually performing it on people, as well as diagnosing people with malnutrition. And the population that we see in Chabert does allow us to do a significant portion of that. And then in addition to that, I do try to incorporate some instruction on self-injection of insulin, as well as self-blood glucose monitoring. We have some simulation materials available that I utilize to try to reinforce and incorporate those skills for the students.
All right, perfect. Well, that was all the questions that I had. So I would love to end this episode with a quick take-home message for potential applicants from each of you.
For me, one, good luck. I know this is a stressful time for all of you. We've all been there before, and just breathe through it and understand that it will be okay. And wherever you do fit in, make the most of that experience. Your experience in your internship is largely what you make it. Your attitude and your mindset throughout it can really make or break your experience. So come into it ready to work, and look forward to hopefully, you know, meeting a good chunk of you. That's it from me.
Yeah, as Ashley said, you know, it is definitely what you make of it. It's only a short time in your life. It's difficult, but it's doable, and you can do it. Just take one day at a time and choose Nicholls. That's all I have.
Thank you again, Sherry and Ashley, for being with me on the podcast yet again. And for those at home who would like some more information on the program at Nicholls, you can check out episode 20 of this podcast that we recorded last year. And to get in touch with Sherry or Ashley, I've included their program website link in the description below this video. And as always, don't forget to like and subscribe so you never miss an episode with another awesome dietetic internship. And we'll see you next time. Bye.